the Toronto Star. I'm Raju Mudhar, and this matters. From the countless images of families forced to visit elderly members through windows, to those with far worse outcomes as this deadly disease rips through long-term care facilities, claiming the lives of loved ones and the support workers on the front lines working at these homes, COVID-19 has exposed just how vulnerable these places are. Long-term care facilities are where the locus of this illness is now, and where more resources are needed to fight this disease. Today we'll be joined by two of the Star's investigative reporters, who have been looking at the different aspects of the coronavirus and the long-term care issue. Moira Welsh has been covering care for the elderly and long-term care facilities for much of her career. She's been speaking to residents and frontline workers to really see what's happening on the ground right now. Beyond speaking with us, Moira will also be taking your questions in a long-term care live chat at noon on Thursday, May 7th at thestar.com. But first, we're going to be speaking with Jessie McLean, who along with our colleague Alicia Hashem, have been part of a team that took a look at the first 100 days of COVID-19 in Canada. They focused on long-term care facilities and wrote a comprehensive piece that looks back at how this issue was neglected for so long and how that led us to this breaking point. Jessie, thank you so much for joining us today.
Hey, thanks for having me.
Your piece actually looks back almost over 20 years, a lot of government reports that set up guidelines and what to potentially do in this situation. And yet, a lot of these warnings basically collected dust. Can you tell us a little bit about that and why that happened?
There have been several guidelines and kind of preparatory reports written, some by the federal government. For example, in 2013, there was a Canadian Pandemic Influenza Preparedness Planning Guidance. Several at the provincial level. There's a notable one from the called Ontario Health Plan for an Influenza Pandemic. And then there are some provincial reports also looking at kind of novel respiratory viruses. And a lot of the warnings that were included in these or things that we ought to be prepared for have reared their heads again. And just to dive into a few examples, one of those reports recommends that the preparations include the ability to separate infected and healthy residents from each other in a healthcare setting or a long-term care and allow staff not to cross between them. And I think to the average person, this would seem like infection control 101. You have a sick person, you don't put them beside a healthy person. And what we have found by talking to frontline workers and some allegations that are included in court submissions is that that wasn't always followed. We had staff, whether they couldn't access more PPE or just because of the way the approach was, caring for same residents throughout the home, regardless of whether they had symptoms or not. And one of the great concerns obviously being that the staff could become the vector and spreading it throughout the home in a situation like that. And this guidance also kind of highlights what is a legacy problem with long-term care, is this is a horribly underfunded system, and you have a number of homes in Ontario that have ward beds, 2, 3, even 4 people in a room. And as the experts we've talked to, you just fundamentally can't have effective infection control in a scenario where you have 4 people in a room, because if one gets infected, the other 3 are essentially sitting ducks. And the guidance in a lot of these cases and what happened in practice is you would use privacy curtains to draw them between. And that seniors advocates we spoke to, families found that appalling. And one of the most tragic kind of descriptions that we heard was frontline staffers describing that they were incapable of actually separating residents as they would want to until enough people died that rooms became available to be able to isolate someone who was showing symptoms in a room by themselves. Just because the homes were at such capacity already. This was such an overburdened system that they couldn't handle proper infection control. Another recommendation that comes out of those reports is in the Ontario context, there are plans that health organizations develop a 4-week stockpile of PPE. And we heard from frontline staff saying that they were only being allotted 2 surgical masks for every shift, which case you're caring for everyone with the same equipment on. What eventually happened in some of these homes is when the outbreak happened, they just would treat every resident, regardless of symptoms, as having COVID, just because it was the only approach they could do. And I think the most perhaps telling report is when we look back at the SARS Commission and the crisis that it took over Toronto and Ontario back in the early 2000s. And that commission kind of presciently says, and I'll read it, SARS taught us that we must be ready for the unseen. That is one of the most important lessons of SARS. And the central criticism that a lot of experts have is that Ontario was slow to respond to the threat to long-term care. We knew these were among the most vulnerable people to this horrible virus, and yet firm action took took much longer than it did in other jurisdictions. And long-term care deals with outbreaks all the time. These are places that have defined protocols, but these are things for something like seasonal flu or a gastro bug, which for someone who's immunocompromised or who's a frail senior can be a very dangerous thing. But those protocols are no match for this vicious COVID-19. And I think we've seen that play out.
I think as you lay out with the dates, we had a lot of warning signs from Wuhan. Healthcare professionals started sounding the alarms. And as you say, a lot of the actions at LTCs didn't really start happening until a couple weeks later. Why do you think that is?
A few reasons. One, I think looking at Wuhan and Lombardy in Italy, there's these horrific scenes of healthcare networks being overrun and ICUs becoming incapacitated. And when that happens, the entire hospital system just kind of falls like a Jenga tower. And so there was great fear of that, and there was a lot of concentration on acute care. Seniors advocates and doctors and experts who we've talked to say is that there wasn't enough consideration of this virus, this pandemic hitting on multiple front lines, that the long-term care wasn't really considered until cases started to percolate there. And at that point, these experts feel it was too late. As you just pointed out, the critics of how the government has handled it point out, we knew this was coming. You look at, by mid-February, China's Center for Disease Control had data showing that the fatality rate for victims over 70 was almost 23%. Again, in early March, ICU doctors in Italy found that of, I think, about 105 deaths, the average age was 81. So we knew that this was the population perhaps most in the sightlines of this virus. They were in the crosshairs, and the focus was primarily on, in the early days, freeing up acute care space. And certainly people within long-term care and seniors advocates feel that speaks to kind of a greater issue where we just don't value long-term care as a health system, and also speaks to ageism where we don't value the lives of our seniors, especially those frail and vulnerable who need assistance to live as much as we do others. And so that it's often an afterthought. That ageism is no more is exposed certainly in a situation like this when we're seeing widespread deaths across the province and across the country in long-term care.
I know these numbers are moving and growing, but just right now, can you give us a sense of where we're at and what the scope of the situation is right now?
What's important to note is just looking at the day-over-day increases, you're seeing jumps of often 30, 40, sometimes well higher than that. And one of the things that I've always found alarming is that 5 days ago, the media may be focusing on an outbreak at one long-term care home. A week later, there are 5 new long-term care homes that have even more fatalities. It seems that it's not an issue unique at one. This is something that's happening across the board. And certainly some long-term care homes did an admirable job instituting some rigorous measures, even ahead of the government's orders. Others were following the government directives, which have come under criticism as being recommendations for too long, and when they became orders, it was a little late, is the feeling among some of the experts who are following this closely.
We're far from out of the woods right now with this. This is obviously sort of where the outbreak is definitely centered right now. Jesse, you've done a really good look back that brought us up to this point. I think we all know that this is a huge problem that needs to be dealt with now. Is there anything that I didn't ask that you think that our listeners should know?
If I can offer a glimmer of hope in all this, and it's something that several people have raised, in that this crisis has really exposed the fractures within the long-term care system and how we care for our seniors and how we treat those who are among the most vulnerable. And I know there are people who are hopeful, and I think we all ought to be hopeful that what emerges from this is a societal rethinking of how we provide seniors care and how we treat people and how these homes are structured. Because some of these issues were missteps or flat-footed response, but some were deep structural problems rooted in underfunding, rooted in not appreciating, both in terms of financial pay and benefits, vital staff like PSWs and what they do. There are these kind of deep-rooted problems within how long-term care works that people think without fixing those, the next time there's a pandemic, the next time there's a bad outbreak, we're going to be seeing some of this repeat itself. And I think the glimmer of hope is that out of this tragedy, we can be better prepared and fix the problems that are there.
On that note, Jesse, I want to thank you so much for your time.
Thanks for having me.
Jesse McLean is an investigative reporter at the Toronto Star. Now we'll be speaking with Moira Welsh, a member of the STAR's investigative team who has been reporting on seniors' issues in long-term care homes for over 15 years. She joins us to talk about what she's hearing about what's happening right now. Moira, thank you so much for being with us.
Thank you for having me.
There's a lot to unpack about the disaster occurring right now in long-term care homes, but I want to start where things are right now. From your reporting, what can you tell us what's happening inside?
People are terrified, I would say, and I'm talking about the workers and the families. Unfortunately, the families are on the outside, and very few, to my knowledge, have been able to go in and hold their parents' hand while they are dying, which is a whole other level of trauma that people will have to deal with. But inside the homes right now, I think workers are just really scared. The ones who are there are working very long shifts. Some of them are being put up in hotels to alleviate fears of going home and spreading it to their families. And some who do not yet have COVID in their homes are just sitting back and watching with fear. And I spoke to one woman who's a registered practical nurse, and she's a veteran. She's been through SARS. She's been through a lot of different issues. And she said that there's a team of workers in her home that have volunteered to work with people with COVID if it does in fact come. And what she's learning about some of the deaths, not all, but some of the deaths, is so traumatic that she says that they just simply don't understand what they're getting themselves into. So she admires them and she fears for them.
One of the heartbreaking anecdotes from your most recent story talks about how workers are trying to keep patients sitting upright to help them breathe. Can you tell us a little bit about that?
Yes, you are right. That was pretty devastating to hear that. And I think in some cases, especially when they're trying to sort of prop people up in bed, that is something they're doing out of absolute desperation, especially when people are in the final stages of life. But there is actually a medical reason for that. And I contacted one of Canada's leading geriatricians named Dr. Samir Sinha. He's with the Sinai Health System. And I asked him about this practice. And he said, in fact, with many older, frail people, with or without COVID, that is a practice that medical staff and caregivers try to do as much as possible, simply because when you're sitting upright, especially at a 90-degree angle, you're able to get more oxygen into your lungs. So he gave an example of a frail older person who might be confused or suffering from delirium. And delirium is just extreme confusion. And he said what staff want to do in those cases is to get people sitting upright, sometimes in a straight back chair, which is like a lazy boy chair at the side of the bed. They'll be able to sit there and just breathe and calm down. The other point that Dr. Sinha raised is that gravity helps pull lungs down. So if you're sitting upright, you're more likely to be able to get a bigger breath, which actually helps oxygenate your blood and your brain. So it makes sense that this is a practice that people are using in homes.
Now, you've also heard that they've had to take some extreme measures to try and sort of tie these people up or to support them against their beds, correct?
Yes. And my understanding is that a lot of people, especially when they're very, very sick with COVID and possibly in the dying stage, are simply too frail to sit upright on their own. So nurses have been talking to each other about what they do in those situations. And for example, some people might use pillows to try to help someone stay upright. And in other more extreme cases, they might use a bed sheet to try to sort of wrap around them and the back of the bed to keep them in place. And then staff can sit with them and they're told just to speak calmly and quietly and hold the person's hand and just to be with them while they die.
Moira, there's been a lot of warnings about the issues that have been going on in long-term care homes and that they were set to implode. From your perspective, what sort of led up to this point, and why has COVID-19 been able to rip through these facilities?
This has really been years in the making. And long-term care has always been considered what a lot of people in the field would say is the second cousin of hospitals. So they do not get the same funding and the same attention from government that hospitals would receive. But at the same time, so many of the people living in the homes are as sick as many people who are staying in hospitals. And that's being simply because we are all living longer, and with older age come more health issues. And so people are coming into long-term care frailer and sicker than they did in the past. But long-term care was really created for people who came in at a much younger age and possibly died a lot quicker. So with that in mind, fast forward to this pandemic, these homes don't get the funding or the attention that they actually need to care for such a high needs group of people. There are many reasons why it was going to come in, but certainly the protections weren't in place. So you combine that with a low-paid workforce that has people working multiple jobs, sometimes 2 or 3 homes, and they're going from one home to the next, to the community, riding on subways and so on. And with that, the spread was enabled. And then you bring that into a home, which is built maybe 30 or so years ago and has these, what should be old style of wards, so to speak, big units with 30 or more people living in them. That enables the spread of COVID. Also, a lot of these homes that are old have 4-bed wards. That's what they call them. So 4 people living in one room. Again, very close quarters. The other problem is there wasn't enough masking going on for all staff. There wasn't enough testing going on at the right time. And other simple things like people simply eating together and congregating in a dining room, for example. And I spoke to one man whose father-in-law died in a home. There were a lot of deaths in this home. And he said when they went to the funeral home and they looked at the other obituaries, they could see the faces of people who were sitting at his table and other tables. So they all shared the same space.
I mean, it sounds like a perfect storm, but it's one of these things that's not going to go away anytime soon because the emotional trauma that's currently being felt by families and workers. Can we talk about that and what that's going to be like moving forward?
Yeah, that's a tough one. The families I've spoken to, I feel like the guilt that they will hold will last for a lifetime. It's really, really sad. And it's not their fault that they cannot get inside the homes. A lot of homes, some have said that they would allow people in, in grave circumstances, but that isn't happening in all of them. And some people are also afraid to go in as well because they have children in their own homes. So it's a real balance. We know the homes are trying, some with virtual visits through FaceTime or window visits. And that seemed like a good idea at the start. But as COVID takes hold and more people are getting infected, there's less time to have a FaceTime visit with your mom. And for many children, it just feels like it's cruelty that their parent is dying alone and they can't be there for them. They also really don't know if staff have time to sit with them and to, help them to the washroom or change briefs and help them eat because a lot of older people need help eating. So it's just this horrible feeling of the unknown. And their parent who raised them is sitting in a room by themselves.
That trauma is also being faced by these overstressed workers who a lot of times are sort of taking these familiar roles in those last moments, correct?
Yes. And those workers, I have to say, these are people who, it's a bit astounding the amount of care that I'm hearing people are giving. Under the circumstances, people are working 12-hour shifts. Some are staying in hotels for their family's protection as well as theirs. But they're really dedicating themselves to the people in their care. But at the same time, they're terrified. They know that their colleagues are infected and they know that they could be infected as well. And yet they're still going in there and helping people. And I think probably one of the worst pieces of that is the fact that this dedication that they're giving is also combined with this inability to really help the residents in their care. And so they're watching them die. And now when your resident dies under new directives, you must also now care for their body. One of the new directives that has come out has required that the personal support workers or the registered practical nurse who cares for a specific resident now has to deal with that resident's body when they die, whether they died from COVID or something else. And funeral homes are no longer coming into nursing homes to pick up bodies the way they used to. So this adds another layer of trauma. Imagine caring for someone for 5 years and they've become, in a sense, people say, a part of their family. Not their biological family, but someone that you would see on a regular basis and have a pretty deep relationship with. And now that person has died and you have to put on a tag on their toe. You have to wrap them up. You have to get a couple of your colleagues to help you put them inside a body bag and then zip up the bag and then wash that bag with your resident inside of it with bleach, and then take the person outside to the funeral home. That is a whole other level of trauma that people are now dealing with.
This entire story is heartbreaking. Well, I think that the thing is right now, there's been these warnings about these issues for a really long time. Do you think this is the strategies that finally will force politicians to act?
Well, if it doesn't, then nothing will. If you look at it this way, changes made now from many aspects of long-term care will affect us for the next 30 years. So if you want to put that in perspective, for a lot of people, that means we're not talking about the others, the older people who we don't really look at right now. We're talking about parents or ourselves. And I think the good piece of this, if there is one, is that advocates say they are banding together to push for change like they never have before. And new topics are coming up that have not necessarily had traction before, such as national legislation for long-term care. And this is something that people are now widely discussing. And this is on the political radar. And I think because of this, what I would call generational trauma that people will now experience because of what's happening to their families and because of what's happening to workers in the homes, I think politicians have to pay attention to this. And so I think the goal for advocates now is to see how far they can push this to get real, legitimate change that actually transforms the system.
That talk of the National Care Act, what does that need to address for it to be effective?
A couple different things. One is it needs to link money to results, but it needs to address principles for better care. And so that would include, for example, a staffing strategy. Pat Armstrong is a York University professor who's renowned for her research in long-term care, and she discusses this in detail. And she says that the staffing strategy should look at wages, a one-home work site, proper training, registered staff, and again, funding based on homes that are required to conform to those principles. So national legislation would have to look at the health system. So it would look at ways that hospitals have been funded. For example, giving directives for the type of staff who need to work in homes, whether it's registered staff, and talking also about dietitians and housekeepers, and enshrining that in a sense in principles moving forward so that homes actually have a strong and well-funded system to offer the backbone of care. There are other pieces of that as well. So homes need to be, for example, more accessible. We don't have enough. There has been a long waiting list for long-term care, for example, which forces a lot of people to spend money that they probably don't really have on retirement home rooms, even though their needs are similar to those as people who are actually accepted into long-term care. And an act could also create conditions for a really strong, empowered workforce, which is, again, probably the backbone of what long-term care needs. So it would need more staff, but also it needs people who are empowered. And again, Pat Armstrong has told me about a home she researched in Manitoba where they have very low turnover because the staff are either full-time or dedicated part-time. They are allowed to play a stronger role in the care of the people in the home. So they're not sort of placed on the bottom rung and diminished by being told to just get your 6 tasks done, per 30 minutes and then move on to the next resident and so on. So it's not this sort of rushed system that allows no one to feel good about themselves, exhausts people, and probably leads to a lot of attrition. And staff in some of these homes are able to have really deep discussions about the work that they do. And so that makes a big, big difference in the type of care that people would receive in homes, because if your staff is empowered, then the residents are also better treated.
Moira, that's really, really great for us. Is there anything that I didn't ask that you think that our listeners should know?
I think we did talk about this, but I do think that people should sort of wrap their minds around the thought that what we do now is going to impact us again for the next decades. And so, for many of us, we think it's so far off in the distance that we don't really have to think about it too much. I think the experience from COVID, some of the changes that we could actually bring in right now can make a huge difference because it will affect all of us in the not so distant future.
Moira, that was really, really great. Thank you so much for your time today.
Thank you.
Moira Welsh is an investigative reporter with the Toronto Star. If you have a further question for her on this topic, thestar.com will be hosting a live chat with her scheduled for Thursday, May 7th at noon. You can go now and ask a question at thestar.com/longtermcarelive. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudhar, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.